Hi everyone, welcome to Fast Intelligent Care. This is our part 2 with Lizzy Parsons, occupational therapist and solutions specialist with Country Care Group. So when we're going to talk about seating, there's obviously a lot of things that we need to consider, pressure, posture, the size of the chair. But Lizzy, with your experience, 5 years of experience with Country Care Group, what are some of the most common seating issues that you've been called in to support? And what are the typical causes for those issues?
So within my role here, I don't have much to do with kind of like the wheelchair side of things. We did have a wheelchair scripter here previously, and so he did a lot of that kind of stuff. So I've not been in kind of the complex seating space as such, but I guess probably the main thing that I'm involved in really is people coming off the street into the showroom. And mostly it's been around pressure care. So we have people come in and say that my husband or my elderly neighbor next door has got a sore bum or has, got pressure problem on their bum. What am I going to do? So already like terrifies me when people come in like this, right? Because already the red flags and alarm bells are like sounding because I'm like, why has this happened? And there's so many other factors as to why this person might have a sore bum. And in my scope here, it's not like I can do a sit down, do an initial assessment with them or find out what their like home environment is like or what they're sleeping on and things like that. So it's very hard. I have a couple of like key questions I kind of ask to try and get some basic information. And then it's obviously talking to them about the importance of pressure care. And usually they're wanting to look at cushions that are kind of like the standard foam cushion because they think they just need something that's going to be comfortable rather than the whole dynamics of, the importance of envelopment and being suspended in air, all offloading and all that kind of thing. So I have to try and like sum up stuff in a very quick nutshell because these people generally don't know kind of much about it. So generally pressure care is where I'm most involved with. I always can hear when I'm sat in the office when someone comes in because the cushions and stuff are kind of near where my office is. And I can hear the guys on the front desk as soon as someone's like, oh, so-and-so's got a sore bum, they come and get me.
Yeah.
To kind of have a bit of a chat to them. So I'm always trying to recommend they go back to their GP. Because there's obviously other factors going on there. The reason that they might have a pressure injury start on their bum, on their sacrum or, coccyx, wherever, it might not even be to do with what they're sitting on. Maybe it's not that they're moving in bed or maybe that's, the recliner chair's standing up and they're slipping down and it's causing shearing. Like, you just can't know when they just kind of pop into the showroom. You've got no way of knowing anything. So, I always try and get them to touch base with their GP and suggest that they organise an OT assessment. I'm trying to, with limited information, trying to help people with pressure care needs, really. That's probably where I'm most involved, Yeah,
I guess pressure care being such a... Actually, like you said, it's almost like alarm bells, like a very scary thing to deal with because of how serious it is once you've developed depression. So I can imagine it's, And
I have to try and get that across to them a bit as well, like without scaring them. Like, this is a serious issue, like you need to try and put some stuff into place to get this sorted. And you know what, some of the people that come in, they're not part of aged care packages, or they've just got no support whatsoever. And the cost of a Roho cushion as well, that literally gives people heart attacks. So luckily we've got a defib here in the showroom. Haven't had to use it yet, but I am assuming that at some point we will, because the Roho cushion price will give people a bit of a heart attack.
Yeah, I guess that's probably why a lot of people going for the foam as well. They
That's
comfortable, but they don't expect it to cost that much.
no, that's right. And it's yeah, trying to explain the differences between all the different kind of support surfaces and why we use, we kind of choose stuff above foam really. So yeah, a little bit of education there.
Do you also get walk-ins for your recliners as well, or is that?
Oh yeah,
Lifting? Okay, yeah,
lots of walk-ins for recliners. So within the company here, I'm really lucky. I got given the opportunity to kind of help people in the kind of learning space, like our staff. So, lots of staff come on board from lots of different industries that have nothing to do with healthcare. They might have been working at JB Hi-Fi or on Sports Girl or something like that. They've never even heard of a pressure injury. So a lot of our induction process is around kind of product training, and we're trying to expand on that actually at the moment. But we do have a program called CCG Fit, so Country Care Group Fit, which everyone has to cover in their induction when they join the company. And within that is basically me waffling on about the importance of how to fit people for recliner lift chairs, how to fit people for wheelchairs, and what questions to ask. So the induction process goes through what questions you need to specifically ask for people coming in with a recliner lift chair, and then how to fit people for a chair. So with that kind of knowledge, the guys here can use that when people come in off the street. So kind of what OTs would ask, with them not being OTs. But obviously those questions that OTs ask are so important when you're trying to select like a recliner lift chair. So the guys know that when people come in here and we have this vast array of recliner lift chairs, that they need to be asking, questions like, is the person, are you sitting in the chair all day? Are you experiencing any discomfort in your current chair? And if so, where? Is there any cognition issues that we should be aware of? Is there incontinence kind of issues as well? Any postural requirements? All these kind of things can narrow down the options when it comes to chairs. So, yeah, it's good that I've been able to kind of assist with that here to make sure that we're kind of confident when people come into the store that they're being actually looked after in the right way, and that a chair is selected not just because it looks good, but because it's going to help them. Yeah, which a lot of people come in and that's their main goal. We find actually a lot of the time it's the husband that's got all these clinical requirements, but the wife just will not budge on the color of the chair she wants. Oh man, it's hard work. But as OTs, you'd all know that this happens to you as well. So yeah.
So I having to like try and explain the clinical benefit of it versus
that's exactly.
Yes.
But we find that, I think we've said to you before, with the configurer. So don't want to be biased, but it is one of our fave chairs here. And it's a great chair, but I think you might agree it's probably not the most attractive. But Chanel, not saying anything, quiet. So yeah, it's hard to kind of have that conversation with people around the importance of getting their clinical needs met, and then it's not all about what the chair looks like.
Yeah. What I like, kind of helping OTs with that when they do tell me about the client being resistant to the aesthetics. I always talk about how you get these recliner chairs that have all these different colors. There's like pistachio green and cherry red, and there's actually quite a lot of this was like decision paralysis, where there's almost too many options as well. Like obviously I do want always to control, but there's a point where
Yes.
the client kind of goes back and forth because there's just too many to choose from.
Yeah, and it's so hard, right? Like we at one stage here, we had 26 chairs, recliner lift chairs on the floor. We've got quite a good showroom here, so we have 26, like all different sizes and stuff of like certain brands, but it's overwhelming. So yeah, that's why all these questions are so good, right? Because then you can hone in to what the best chair is.
Yeah, and it's also coming back to like even when you're doing like wheelchair scripting, there's not always or very rarely actually, is there a product that is going to fit every single tick box that you have. I remember going to a training, you saying, choose what is most important most of the time, and that like have a priority list of it needs to have tilt and space, it needs to have this pressure care cushion, it needs to have this partial support, and then if aesthetics isn't your priority list, great, that's fine, but make a priority list, and then you are going to have to sacrifice something.
And I think it's really important as well to understand that there's always going to be probably compromise. You're very lucky if you don't have to compromise with a piece of equipment. And I think it's also really important, and I say this to the new grads as well, is to never kind of get the client to over expect this piece of equipment is going to solve all their issues as well, and let them know that this piece of equipment is going to be perfect for them, and it's going to, it's just setting up expectations when a piece of equipment might not be able to do everything they want it to. So yeah, some lessons learned from that as well previously. Yeah.
Well, something that I wanted to ask as well, is there any seating, so this could be wheelchairs, recliner chairs, commodes, any specific features that you found were kind of really great, like always really beneficial for clients to have, something that really stands out? It's like, let's say it's leg elevation or tilted space. Is there something that you
definitely tilt in space? Love tilt in space. What a great invention. I wish they had tilt in space or more as an option on more things. I think it would really help, particularly recliner lift chairs. Obviously, the configurer has got tilt in space, which is awesome, but there's actually very few other chairs that like we do here. We've got the Olivio Donatello Plus that has tilt in space here. But other than that, we're very limited on kind of reclining lift chairs with tilt in space. And just, it's just so much easier for manual handling, if people are using lifters and things like that, trying to get them into like a commode that's that 90-degree angle or a wheelchair, it makes it very hard. So yeah, if there was more kind of tilt in space kind of options within those, pieces of equipment, I think it would be really beneficial.
Yes. Did you find that tilt in space has been a newer feature? So within the 5 or so years that you've been with Country Care Group, has it become more common, or has it always been a feature that's been?
Yeah, I mean, for me, it's always been a feature that's been sorted after. But saying that, I don't think I knew much about it before I then came into this industry. And I know a lot of OTs I've worked with, again, new ones actually don't know what tilt in space is. So, then I explain what it is and show them what it is. And they're like, oh, like they didn't even know it existed. So I think people get a bit confused as well, because like it's called zero gravity. There's a couple of different, like, that's kind of like the marketing name for it, I guess, zero gravity. And can be a little bit like confusing.
Exactly. Yeah. No, tilt space has been great. I've actually had a training once with an OT group, and one of the OTs just asked me, she's like, "Why do all chairs not have tilt in space?" And I was like, "That's actually a good question." I guess.
I know. Yeah.
it's maybe makes the product maybe a bit more expensive, but yeah.
Yeah, I think it's to do with the motors and things, and also the space, I guess, as well, because obviously when it tilts back, it takes up more space, particularly like commodes and things. Like if you get a tilt in space commode, it's generally pretty cumbersome. It's pretty big, and you can't really fit it into the shower and stuff. But some of the chairs are good in terms of like they tilt in space, but they kind of like roll in a forward motion, and that kind of works pretty well. So you haven't got that extra behind that space you're kind of using up behind. But yeah, I feel like there can definitely be some better improvements around equipment utilizing tilt and space. Yeah, for sure.
Something that I've also wanted to ask you about is if you feel like when it comes to seating, when it's maybe a bit more complex seating as well, what is a helpful starting point for OTs to build their knowledge, their confidence? Where would you point them to? What would you tell them to?
For if we're talking kind of complex seating, I think it's always a good idea to try and do a wheelchair like scripting course, right? Because it just gives you the absolute basics. Companies like Permobile and Sunrise, all those kind of wheelchair companies, they offer quite a lot of those kind of education sessions. Particularly around just starting at the basics and being able to, script chairs for people and understanding the basics of how to script a chair, and just able to be understanding as to how the person sits in the chair, the different kind of complexities that, there's pelvic obliquity, rotation, all those kind of things, and having a really good knowledge of that kind of background in terms of, someone's positioning, like will just help in everything, from wheelchairs to recliner chairs to commodes, like anything then complex, you kind of got the basics of. So, I think if you're going to get into that kind of space, I think the first stop is doing some basics of wheelchair scripting and even like the mat assessment and things like that. A lot of OTs aren't involved in that kind of space anymore. I can't say I know very many at all that actually do a mat assessment for any of their wheelchair clients. Very rarely. We even bought here like a plinth so that OTs could use it for mat assessments, but it's actually probably be used once or twice in the 5 years I've been here. And that's even following education for mat assessments as well, where we've had the wheelchair companies up and they've done basic mat assessment training. I think the issue that we have is that, when OTs go out and see clients and their client caseload is so varied that they might have someone that requires a mat assessment, but then they won't see another client that requires a mat assessment for maybe a year or more. And then, all that confidence and everything they've learned within that session is gone, and then they're back to feeling unconfident again. So then they just don't do it. Yeah. And I think that's the problem as well, as particularly around wheelchair scripting and things, is that OTs are not doing enough of it to be competent and confident with it as well. So I think that's a big issue, because their caseload is just so varied. So they can't, like we say, we can't know everything, and not everything can be retrained in the brain. And if they're not doing enough wheelchairs, then it's not gonna be something that they feel comfortable with all the time. I mean, it's the same with me when I was working in the private hospital. I went on like a 3-day course to do with stroke, because we had a couple of stroke patients. It was a brilliant course. However, I never saw a stroke patient then again for like a year and a half. And by then, You know, I still had all the information I could go back and like revise on, but it's never good enough when you've just learned that stuff and then you need to, you know, and then going into straight away and kind of doing it often.
Well, I've had quite a few OTs that I've seen a couple of times at the same training. So I'll do like a configure a recliner chair scripting training, and they'll come again, and I'll be like, "Oh, but that's basically the same." But they're like, "No, I have a different client this time." So like,
need a refresher. But I think that's great, right? Like we have the saying. I have a few OTs that just come to all the sessions pretty much because. And I'm the same when I come to go to all the sessions, because obviously I'm organizing all the supplier sessions and then I sit in on them, to give OT support and also for my own benefit. Like it's great for my CPD points. I've got loads, attending them all. But it's great because a lot of the stuff you'll go through, like for your sessions, for example, you'll go through stuff and I've been in about 5 sessions now, so I'm pretty aware. But I always learn something new.
That's great.
Always, yeah. Whether it's from you or whether it's from someone else in the room, because there's always different people in the room, and they have different, they've had different experiences and things like that. So it's always good to go to as many as you can, and even if you've been before. And you don't, a bit embarrassed to go back because it looks like you didn't remember anything. I think it's still fine to go back. Like, it just reinforces more in your brain, I reckon, if you do these things a few times.
Yeah, and like you said, it's for us as clinical educators, it's actually so nice being able to learn from the OTs that are bringing their case studies and saying what worked for them, what didn't work for them. So it's, like I said, if you're going to these CPD events, you're not just learning from the clinical educator, you're learning from your OTs.
Yeah.
As well.
What a great job we have that we can liaise with all these people on a daily basis and gain all this knowledge, It's good.
Well, we'll go on to manual handling, so looking at slings, hoists, transfer aids in our next session.